Now what lies ahead of us? Personalized medicine, as I said, personalized healthcare, personalized education, personalized teaching. They're not future, they are present. They are present, they are happening now as we are talking. We are doing it, many others are trying their hands on it, and it's getting better every day. What lies ahead of us is something like this. Let me use an analogy here, right? So, how do you train a pilot to run an aircraft? You don't put them in the cockpit in the first place, right? And you start with a textbook. First of all, they have to understand the physics behind it, they have to understand the electronics behind it, they have to understand the whole mechanical engineering behind it. Once they have done that, and they have to really pilot the aircraft, you tell them how to do it, and then you make them practice, right? Once they have practiced enough, they have reached a certain level of competency, then you make them sit in the cockpit with a couple of other senior fellows who tell them this is what you do when you sit inside, so that their anxiety, they can win over their anxiety and see how things are actually happening in the real time, and then make them. Same analogy is going to happen here. Even today, how we are training our surgeons, most of them, by the way, except for a few cases, they get their first practice on a human body. While it's probably wrong to say that at least in the next 5-6 years time frame, computers or simulations will replace everything. But it won't be wrong to say that at least 80% of the surgical procedures that we have to do as residents, or our future generation will be practicing as a future residents, they'll be practicing on a simulator before actually touching a patient. Like for us, it was like C10, assist 10, then do 10 under supervision, and then do independently. It will become maybe C10, then do 10 in a simulated setting, then assist 10, then do 10 in a real setting under supervision, and then go forward. But what is happening is, it's not that the learning process is getting longer, it's that those who are learning it and those who are actually coming out of it, they are more competent in what they do. They're more capable of actually delivering quality care. And that is what will make healthcare more cost efficient, because the errors will go down. It will make it more safer. It will make it, I guess, in general, higher quality. And again, as I said, the philosophy, the strategy is to put the common man or a patient in the center. The biggest beneficiary of that is the patient. Because even if, as a surgeon or as a trainee surgeon, I make one mistake out of 1,000, that's the statistic for me. For that poor one who actually was suffering, it's 1 out of 1. Correct. And what we need to work on is to reduce that 1 out of 1 to 1 out of 1,000. And that's one of the ways I think that's one of the directions we are taking. There are many other things are happening simultaneously, but one of the things definitely is to bring in, again, using this technology and big data and analytics on the way. That's what simulation does for us. So that's one of the things I see happening in next maybe 5 to 10 years.